15 symptoms and causes of poor circulation in the arms and legs. Introduction. Poor circulation is a condition in which blood does not flow properly through the arteries and veins of the body. The circulatory system is responsible for delivering oxygen, nutrients, and hormones to tissues while removing carbon dioxide and waste products. When blood flow becomes sluggish or restricted, the arms and legs are usually the first areas to be affected. This is because they are the farthest from the heart and therefore most vulnerable to reduced oxygen supply. Poor circulation itself is not a disease, but rather a clinical sign of underlying health issues such as peripheral artery disease, chronic venous insufficiency, blood clots, diabetes, obesity, or heart conditions. Symptoms may vary from mild numbness to severe pain, swelling, or even tissue death. Identifying these symptoms early and understanding the possible causes is critical to preventing complications such as ulcers, infections, or amputation. In this video, we will explore 15 key symptoms and causes of poor circulation in the arms and legs. Each section will explain how the symptom or cause develops, what it feels like, and why timely recognition is vital for health. 1. Tingling sensation in the limbs. One of the earliest and most common symptoms of poor circulation is tingling in the hands, feet, arms, or legs. Often described as pins and needles, this sensation happens when nerves in the affected area are not receiving enough oxygen and nutrients due to restricted blood flow. Although temporary tingling after sitting in one position is normal, persistent tingling may indicate an underlying vascular problem. For example, patients with diabetes often experience chronic tingling because of both nerve damage and poor circulation. Ignoring this symptom can lead to worsening nerve injury and long-term complications. 2. Numbness and loss of sensation. Another clear symptom of reduced blood flow is numbness. When circulation is impaired, the sensory nerves lose their ability to transmit signals effectively. Patients may notice that they cannot feel temperature changes, touch, or even pain in their feet or hands. This is especially dangerous because injuries can go unnoticed and lead to infections or ulcers, particularly in diabetic patients. Numbness in one arm or leg can also suggest an acute circulation problem, such as a blood clot or arterial blockage, which requires immediate medical care. 3. Cold hands and feet. When blood flow is restricted, extremities such as hands, fingers, toes, and feet feel noticeably colder than the rest of the body. This is because warm, oxygen-rich blood is not reaching the tissues in sufficient amounts. In some cases, patients with poor circulation notice that one foot is colder than the other, which can indicate localized arterial narrowing. This symptom is common in peripheral artery disease and Raynaud's phenomenon. Persistent coldness should not be ignored, as it can indicate chronic oxygen deprivation that eventually damages tissue. 4. Muscle cramps and pain during activity. A hallmark symptom of poor circulation, especially in the legs, is claudication, pain or cramping that occurs during physical activity and improves with rest. This happens when narrowed arteries cannot supply enough oxygen to muscles during exercise. People with peripheral artery disease often experience pain in the calves, thighs, or buttocks after walking short distances. If left untreated, the pain-free walking distance becomes shorter over time, severely affecting quality of life. Recognizing exertional leg pain as a vascular symptom rather than just aging or weak muscles is important for timely diagnosis. 5. Swelling in ankles, feet, or legs. Swelling, also known as edema, occurs when poor circulation prevents blood and fluid from returning efficiently to the heart. This is often the result of chronic venous insufficiency, in which weakened vein valves allow blood to pool in the lower legs. Patients may notice that their ankles are swollen at the end of the day or that shoes feel tighter in the evening. If left untreated, chronic swelling can damage skin, cause infections, or develop into painful ulcers. Persistent leg swelling should always be evaluated to rule out venous disease, heart failure, or kidney problems. 6. Skin discoloration and changes. Poor circulation often leads to visible skin changes in the arms and legs. Areas may appear pale due to lack of oxygen or take on a bluish tint, cyanosis, because of reduced blood flow. In chronic venous insufficiency, the skin around the ankles may turn brown due to iron deposits from leaking red blood cells. Over time, skin can become shiny, thin, or fragile, and small injuries may heal poorly. These changes are clear indicators of long-standing circulation issues and often point toward advanced vascular disease. 7. slow-healing wounds and ulcers. One of the most serious complications of poor circulation is delayed wound healing. Cuts, blisters, or sores on the feet and legs may take weeks or months to heal because oxygen and nutrients are not adequately reaching the tissue. In severe cases, non-healing ulcers develop, particularly in people with diabetes or peripheral artery disease. These ulcers can become infected easily and may ultimately require amputation if circulation is not restored. This symptom is a major warning sign of advanced vascular compromise and should never be ignored. 8. Varicose veins. Varicose veins are a visible sign of poor venous circulation. They appear as enlarged, twisted, and bulging veins just under the skin, usually in the legs. They occur when weak vein valves allow blood to flow backward and pool in the veins. While varicose veins may seem like a cosmetic issue, they can cause aching, heaviness, and swelling in the legs. In advanced stages, they increase the risk of venous ulcers and blood clots. Identifying varicose veins as a symptom of poor circulation is important, especially in people with jobs that require prolonged standing. 9. Hair loss and brittle nails on legs or feet. Reduced circulation deprives hair follicles and nail beds of the nutrients they need to grow. Over time, patients may notice thinning hair on the legs, delayed nail growth, or brittle toenails. While this may seem like a minor symptom, it reflects underlying oxygen deprivation in the tissues. In combination with other vascular signs, such as coldness, numbness, or skin discoloration, hair and nail changes provide important diagnostic clues for doctors assessing circulation problems. 10. Fatigue and heaviness in the legs. A constant feeling of heaviness or fatigue in the legs is a frequent complaint among people with poor circulation. This occurs because the muscles are not receiving enough oxygen and nutrients, and because blood is pooling in the veins rather than flowing efficiently back to the heart. Patients often describe their legs as tired, even after minimal activity, and the sensation usually worsens after prolonged sitting or standing. This symptom significantly reduces mobility and quality of life if left untreated. 11. Restless legs and night cramps. Many people with circulation problems experience restless legs, especially at night. Poor blood flow irritates nerves and muscles, causing discomfort, tingling, or an irresistible urge to move the legs. Nocturnal cramps are also common because oxygen supply drops during periods of rest. These nighttime symptoms interfere with sleep, leading to fatigue during the day. Restless legs and night cramps should not be dismissed as simple muscle spasms. They may point to vascular or neurological complications from poor circulation. 12. Peripheral artery disease, PAD. One of the most important causes of poor circulation in the arms and legs is peripheral artery disease. PAD occurs when atherosclerosis, plaque buildup, narrows or blocks arteries outside the heart, usually in the legs. Symptoms include claudication, cold feet, numbness, slow healing wounds, and in advanced cases, gangrene. PAD shares risk factors with coronary artery disease, including smoking, diabetes, high blood pressure, and high cholesterol. Left untreated, PAD can lead to critical limb ischemia and amputation. Identifying PAD early allows for lifestyle changes, medications, and procedures to restore blood flow. 13. Chronic venous insufficiency, CVI. Another common cause of poor circulation is chronic venous insufficiency, in which vein valves in the legs become weak or damaged. Instead of blood flowing smoothly back to the heart, it pools in the legs, causing swelling, varicose veins, skin discoloration, and ulcers. CVI is more common in women, older adults, and those who spend long hours standing. If untreated, it can progress to severe venous disease with constant pain and skin breakdown. Recognizing CVI as a cause of poor circulation helps prevent complications through compression therapy, exercise, and medical treatment. 14. Deep vein thrombosis, DVT. Deep vein thrombosis is a dangerous cause of poor circulation, where a blood clot forms in a deep vein, usually in the leg. DVT causes pain, swelling, warmth, and redness in the affected limb. The most serious risk is that the clot can travel to the lungs, causing a pulmonary embolism, which can be fatal. Risk factors for DVT include prolonged immobility, such as long flights, surgery, pregnancy, smoking, and clotting disorders. Prompt diagnosis and anticoagulant therapy are essential to restore circulation and prevent life-threatening complications. 15. Diabetes and obesity. Two systemic conditions that strongly contribute to poor circulation are diabetes and obesity. Diabetes damages both blood vessels and nerves, leading to reduced circulation in the feet and legs. This is why diabetic foot ulcers are so common. Obesity, on the other hand, puts extra pressure on veins, increases the risk of blood clots, and accelerates atherosclerosis. Together, diabetes and obesity form a dangerous combination that severely compromises circulation and increases the risk of amputations. Addressing these underlying conditions is critical for improving circulation and overall health. Conclusion: poor circulation in the arms and legs is a serious health concern that should never be ignored. Symptoms such as tingling, numbness, cold extremities, cramps, swelling, skin changes, slow healing wounds, and varicose veins all signal that oxygen and nutrient delivery is being compromised. The causes range from localized problems like PAD, CVI, and DVT to systemic conditions such as diabetes, obesity, and heart disease. Recognizing these symptoms early allows for timely medical evaluation, diagnosis, and treatment. Lifestyle changes, medications, and procedures can significantly improve circulation, prevent complications, and save lives. Ultimately, understanding the 15 symptoms and causes of poor circulation in the arms and legs is the first step toward healthier living and stronger cardiovascular health.